Okay, so doctor, the COVID-19 vaccine, it's safe to say that the vaccine is safe, right?
That is a big question that everyone is having. Is it safe? Like, are they giving us the right one? So any vaccine that is developed in the world, they go through a lot of extensive testing. We call it trials, phase 1, phase 2, phase 3, phase 4. Especially they check for the safety and the efficacy when you are giving it to the general public. So likewise, the COVID vaccine, it has gone through the same rigorous procedures, same extensive trials, and up to phase 3 they have completed in all the vaccines that are recommended by the WHO and the other countries so far. So it doesn't mean that just because this went in fast track that it's like taken shortcut, because this is a new disease, this is a global threat. So all the experts in the world got together. It was like a problem to everyone. So getting the resources pooled, getting the labs pooled, getting the facilities pooled was quite easy because everyone wanted a solution. So that's why it was fast track. That doesn't mean it took shortcut. Like doing like that, they developed the vaccine going through the correct procedures. Also, I must say that when we bring a vaccine to our country, we have expert panels along with the Ministry of Health where we check for the efficacy, the effectiveness, and also the faith, whether they have conducted trials properly. We will give approval only to that type of vaccines to be used for the general public. So I must stress on that. So what you're getting is safe. Now, like for example, within last month, we got the AstraZeneca vaccine for the healthcare workers and the frontliners in the country. And people had an issue that it was developed in India. So AstraZeneca is the actual vaccine that is developed in the UK AstraZeneca company and produced in the Serum Institute of India, which is one of the world's largest vaccine producers and where we get most of our API schedule, most of our vaccines through the Serum Institute. So just because it was done in India, it's not safe, that was a myth. So this is the actual AstraZeneca vaccine developed in UK, which was produced to this part of the world in the Serum Institute. So what you get is safe.
The commonly asked question is who is eligible and who is not eligible for the vaccine?
If I tell you who are not eligible, that is actually would be quite easy to come up the other. So why we say these people are not eligible is that the vaccine developers haven't done any trials on these people. They haven't done any trials on the children, the pregnant ladies, and the exclusive breastfeeding mothers who are like the babies are only below 6 months of age. So those people are contraindicated to get the vaccine. We will not be giving those people simply because we don't have data to tell that it's safe for them. The other people who are not eligible are the ones who have ever had any allergic reactions, any severe hospitalization due to a vaccination. The rest of the people, like, all the people, the frontliners, the working population, the elderly, above 60 people, and the ones who are having chronic diseases like diabetes, heart disease, pressure, like cancer, those people are eligible to get the vaccine. But due to the limited supply, we have to prioritize people first and to give the most people with the highest risk first. But eventually it will come to the rest of the population also. Just because you had a food allergy or some medicine allergies, that doesn't mean that you're not eligible, but you must tell it your healthcare provider before getting the vaccine. Then they take the necessary precautions.